Hello again, everyone, and welcome to today's webinar. We're going to get started here in about 60 seconds. We're just giving folks a couple more seconds to get logged in. Thank you all. Well, thank you all for joining us today. I'm Steve Mondrenak. I'm Executive Director here at the Association of Food and Drug Officials. We're excited to talk to you a little bit today about a legislative initiative we've been seeing across the country, and a model bill has been drafted and is circulating to legislators across the country for possible introduction on home restaurants. Once again, as we near the legislative sessions in most of our states here just after the first of the year, we wanted to make sure the programs were aware this was coming and something you were likely to see, and talk a little bit about it. We also are very fortunate to have with us Ken Chandler, who's been through this firsthand in California and Riverside County, and talk a little bit about what they've experienced from California, who was our early adopter of this type of initiative. So first, I just want to talk a little bit about what this initiative is. This particular initiative has been sponsored by the Cook Foundation. We will be sending you after the webinar a link to the model bill, along with some additional information and a fact sheet to go along with it. But it's something that's out there. This was the same group that was responsible for doing a lot of the lobbying to get this adopted in California, and now they're moving it nationwide. Let's go ahead and move to the third slide. Actually, Amy, I skipped a slide. So the model code has some basic provisions in it that we'll talk a little bit about. It requires that these home restaurants be inspected and permitted by the regulatory authority. It allows the sale of time and temperature controlled for safety foods, TCS foods. It allows food to be served in the house, picked up. Online sales and delivery of food is also allowed, along with it outlines an enforcement inspection frequencies. So it's really a whole new type of inspectional program that they're creating for these home-based restaurant businesses. Let's move on to the next slide. There are, as we talk to programs across the country who have looked at this, there are some definite questions or concerns that are out there. So, the conflict with current licensing and inspection requirements, having adequate staff to inspect these facilities, what type of inspection would this be, how would this look, those sorts of things. Is performing unannounced inspections possible or needed, actually might be another question. So those are just a couple questions. We actually have a series of about 20 different questions that we've put together from during some discussions with various individuals that have looked at this law. But we want to go ahead and talk about those with you all after we've done our presentation today. Let's go ahead and move to the next slide and talk a little bit about, there are lots of other things to definitely be considering here. As you all know, when we open up a statute, it often results in more than what was initially put in the proposal. So an opportunity to open up your food establishment regulation or your food establishment statute may also present an opportunity for additional things beyond what this bill is, and we often see that happen. So that's another piece of the puzzle to be thinking about as you look at the potential inclusion of this, or as you watch for the potential inclusion of this during your upcoming legislative sessions. So with that, I want to reserve most of the time today for our presentation today from Ken Chandler, and just a little bit of background on Ken. Ken comes to us from the Riverside County Health Department. He is a 26-year veteran of the retail food inspection field. In his career, he served as a field specialist, training officer, supervisor, and regional manager. His passion is for food safety, and it started really as he was a trainee and moving his way to program chief in Riverside County. Several years ago, Ken created and supervised a unique enforcement program which located and prosecuted unpermitted food vending in all forms, including many home restaurants. Today, he's here to share share his experience with permitting and regulating what was previously a forbidden concept, the micro-enterprise home kitchen. With that, let's go to Ken and be keeping your questions. We will have a ample time for questions, answer, and discussion after his presentation. Ken, welcome.
All right. Hello from Riverside County, everyone. I'm grateful for the invitation to participate in the webinar, and I hope you find my presentation and our experience interesting. In 2019, we found ourselves in a situation where we had to blaze our own trail by creating a first of its kind program. Obviously, we didn't want a giant public failure in front of everyone. For me personally, it was a mixture of great pride in my team's efforts and a bizarre sense that we had somehow betrayed the sanctity of retail food law. Today, I hope to give you a sense of our process in preparing for and implementing the first MECO program. I'll describe what a MECO is, some of the program procedures we developed, the development of our county ordinance, and finally some lessons learned along the way. Now, due to some technical issues I'm having with my tablet, I'm going to turn off my video until the Q&A at the end. So please excuse me for that. Next slide, please. So where the heck is Riverside County anyway? Well, if you take a look here at this map, you can see that little yellow arrow is pointing right to us. Riverside County is home to about 2.5 million people and stretches 7,200 square miles. We're a mix of desert, mountain, agricultural, and suburban communities. It's the 4th largest county in California and 11th in the nation. I'm the program chief to the retail food program, the recreational health programs, and organized camps programs for Riverside County. And just as a reminder, in California, we are under the California Retail Food Code, CRFC, or fondly nicknamed Cal Code. We are not under FDA Food Code, which most other jurisdictions are. So there may be some slight differences here. In Cal Code, we do have an allowance for a couple of home-based retail food operations. They are called cottage food, and the topic today, micro-enterprise home kitchen operations, or MECOs. Next slide, please. So with that bit of context, let's dig into the world of home-based food operations. In September of 2012, California's cottage food law passed. This allows preparation and sales of a selective list of non-hazardous or TCS foods to be prepared in private homes for retail sale. Obviously, the food safety part of my brain short-circuited, and because food from home had always been such a taboo idea throughout my career. At the time, I had no idea how this would evolve just 2 years later. Come September 2018, AB 626, or California's MECO law, passed. This allows full food preparation from a private residence. The law requires counties to opt in or out, and we were the first to opt in. So why Riverside County? Why did it happen here first? Just so happens the legislation was sponsored from our own Coachella Valley by Assemblyman Eduardo Garcia. There wasn't much resistance to the idea statewide, but I think it did catch a few people by surprise when it passed. Locally, it had very strong support from our Board of Supervisor chairman and citizen advocate groups that spoke at board meetings and were speaking across the state. The MECO law stipulates that once a county opts in, cities cannot opt out. So obviously we wanted to make sure our cities were aware of what was coming. So we started our outreach to them in November of that same year, 2018. We only received 2 official responses, and their concerns were about bypassing their own municipal zoning ordinances, changing the character of the neighborhood, impacting the quality of life of residents, and the additional potential food waste and cooking grease that might be taxing residential sewer systems. Come January 1st, the MECO law becomes effective, and we launched our county ordinance on June 5th of 2019. And leading up to this, we had some time to develop the detailed standard operating procedures that applicants must fill out, the application itself, public resources for our website so applicants could be prepared, and began training our own staff internally. Next slide, please. So an overview of what a MECO is. It is a full-service restaurant that operates out of a private residence. Any advertising they do has to have the term loud and bold, made in a home kitchen included. The menu options are open, but they are closely reviewed by the local environmental health department, us, to control introduction of pathogens and exclude risky practices. The no raw milk is allowed, no raw oysters, or making of milk products like cheese, ice cream, or butters. There's no reduced oxygen packaging, home canning, or any sort of HACCP process is allowed, just to keep the risk low. There are operational limits on the revenue earned and the meals they can serve. So a MECO in California can serve 30 meals a day or up to 60 a week and has a profit cap of $50,000 gross annually. It also requires that the food is made and sold within 24 hours. So our concerns about having adequate time for pathogen growth are reduced. There's no reuse of foods, no pre-preparation allowed, no cooling or reheating concerns. It's exempted from most traditional commercial construction finishes and commercial equipment requirements because they are private homes. In fact, the law does include 24 clear exemptions from the standard retail food requirements I'm used to enforcing. Now, the inspections themselves are limited in scope and in circumstance. We do one routine inspection at initial approval or at renewal annually. There's a proviso for additional inspections if there are multiple complaints on the MECO. And finally, in the case of immediate danger to public health. However, all of these are required to be pre-scheduled. They are strictly limited to approved areas of the MECOs. No private areas of the home that weren't previously approved as MECO areas. Now, there is some concern, obviously, about the pre-scheduling. One of the schools of thought to consider may be that whether they clean up and fix things because they know we're coming or because we told them to, either way, they fixed up and repaired things. So I know that doesn't cover everything, but that does help me sleep at night. Customers may dine in, pick up, or have delivery by MECO operators. There are no third-party delivery allowed, such as Uber Eats, Grubhub, DoorDash. Unless the customer has a significant disability, then obviously that kind of option would be available. But in general, these have to be delivered by the MECO operators themselves, so it's sort of an arm's length transaction. There's no outdoor signage allowed advertising the MECO. They cannot advertise themselves as caterers, and there's no grade posting. In Riverside County, we post an A, B, or C grade at an inspection for public view, but not in the private homes. A would be a pass, and B and C are failed inspections. The legislation also promised to bring an underground activity under regulation and provide a small business opportunity with cheap startup costs. We'll talk more about that in a minute. Next slide, please. So our Board of Supervisors opted in and instructed us to write an ordinance. We kind of saw it coming, so we had done some pre-preparation. We had a few stipulations we wanted to add to the ordinance, and then there were specific, just good practices that we wanted to pull out of the California Retail Food Code and include in the ordinance, just in case that's the only thing anybody ever read. Some of those additions, we don't allow the private residents and the MECO activities to mix. We were focused on keeping these activities separate since they'd likely be a source of cross-contamination. I went to the very first MECO inspection, And we weren't there 5 minutes before I heard someone upstairs running around. And lo and behold, down comes a child, very young child with a runny nose and a runny diaper, went right into the refrigerator after their sippy cup. And that obviously, reinforced our concern about keeping the household and the MECO activities separate. We also allow 1 MECO per site, no garages, no second units, or enclosed patios. The operators themselves must get the food manager certification within 60 days. This is an extensive food safety management training, much more extensive than our local program that all of our food workers are required to take. MECO can have 1 employee that is not a resident family member, but they can have their family members work for them in the MECO. Standard food workers, not the operator, must get our local basic food training within a week. Now, these MECOs must have a potable water source. We have some homes on private wells, so we do require a bacterial test of those wells quarterly, a nitrate test annually, and a fluoride test only when we initially approve the property. They must have adequate wastewater capacity. What about grease and other additional burdens to these systems? Domestic systems are frequently undersized due to extended and multiple families already sharing them. So the addition of adding this semi-commercial business to it obviously raised our concerns. Our water boards did not provide much input. Next slide, please. As I mentioned before, there were just a few good general practices we wanted to make sure that we put forward into the ordinance in case that was applicants' only source of information. And these were just good solid standbys, washing hands and sanitizing surfaces before, protecting the food and packaging at all times, requirement for our local food worker training. We do allow domestic finishes in the MECOs, so wooden cutting boards and such. So they've got to be kept clean and in good repair. Now, in over the subject of delivery vehicles, they are usually family vehicles. Our ordinance requires smooth and easily cleanable finishes, but we haven't required alteration of any vehicles or required mechanical temperature support. Most deliveries would be within 30 minutes, and the majority of MECO customers seem to be picking their orders up from the MECO itself. If a delivery vehicle is used, we just recommend they use a bus tub or a cooler or something they can wash, rinse, and sanitize to function as a food compartment, so these meals aren't sliding around in the carpeting inside their personal vehicles. Next slide. One of the components of the California's MECO law is the Internet Food Service Intermediary Platform. These are hosts for individual MECO communities and a gateway for public information or submitting complaints on those operations. Most of these basically help the MECO operators get their business off the ground, advertise their business, and it becomes a community. MECOs can advertise book orders or post customer reviews through these. The IFSIs are regulated directly by the California Department of Public Health. They're not under my local regulatory control. In our experience, there have been a few growing pains. One concern, they can be too helpful. So helpful, in fact, that the applicant is not really sure what they signed, what they're agreeing to, or what this paperwork says. Another concern, we do interact and are open to improving the process for applicants, but it's a thin line between collaboration and endorsing any one of these individual IFSIs. We have to stay neutral as the regulatory agent. Additionally, there's been some exploitation of the rules, such as allowing the MECO to advertise on the platform before they've been approved. But in general, a phone call or an email gets us the correction we need from the intermediaries that we've worked with so far. We know the operators all by name, so we have quick contact with them. Next slide, please. So what about the home inspection? How do we do that? It is a private home, so obviously we have to adjust down from commercial finishes and equipment. We do send 2 specialists when we do the home inspection for a few reasons. Safety. It is a private home. We don't know who lives there, where all the hiding places are. As a witness to the activities, in case there are miscommunications or some allegation of something. It also serves as a fantastic training opportunity for another specialist. We had to resort to a see one, do one, teach one type of method because we needed to come up to speed quickly. It also speeds up the process for everyone, not only to reduce COVID exposure, but one specialist can document, the other can engage the applicant, and we get a nice thorough review of how they intend to operate this business. Paramount is that the operator will have to explain and demonstrate all of the key safety protocols for their approved menu and answer any final questions that may come up. We don't set traps or try to confuse anyone, but we need to have the assurance that they can operate safely. Remember, the operator has 60 days to obtain their food manager training. They are not currently required by our ordinance or by the state law to get food worker training in that time. So sometimes the only training they have is their interaction with us or the materials we give them. We take pictures of what we approved in case there's a question later on. We did catch one operation that participated in a internet food service intermediary promotional video. And we had approved an indoor kitchen and they moved everything outdoors. So obviously we saw the video, busted them, and haven't had them reverse that. Once we're satisfied, we collect a permit fee and they are in business. Next slide, please. So some lessons learned. Some applicants require more assistance and more time. Our largest investment has been time. We had to figure out what to charge these new facilities. So our estimate was 60 minutes for the standard operating procedures review and any corrections required, 60 minutes for the home inspection, 45 minutes travel time, and 15 minutes for internal paperwork shuffling, for a total of 3 hours. So our permit fee is based on a 3-hour rate. In general, on average, it's been accurate. Some have taken much, much more time, and others have been fairly fast. The MECO allowance promised to bring the underground food sales under permit. This has not been the case in our experience. Close to zero impact as far as I can measure. It is nice to have a legal alternative when we're dealing with the unpermitted operators, but the same folks that didn't want to be regulated before still don't want to be regulated. It's still an easy way to make a lot of money with not a whole lot of risk of punishment. And there's nobody watching you, watching what you're doing. So it's still very attractive. In California, cannabis, CBD, and non-industrial hemp products are allowed very recently, as of a couple of weeks ago. And contrary to the FDA, California is no longer considering CBD an adulterant in food or beverages. And cannabis use is legal in California. Not sure if the cannabis edibles will be an approved menu item for MECOs or cottage food, or if there will be restrictions. But at this point, the California Department of Public Health is overseeing the enforcement. Verifying gross income, although it is allowed by the law, I don't know how we would go about doing that, or if we have the right to demand tax records or request receipts. So generally, we don't review that information with them. We take their word for it. All told, it is a leap of faith for us when we issue a MECO permit. We strive to give the consumer enough information through intensive review and descriptive reports that they can make good choices for themselves. Next slide, please. There were a few unexpected challenges. Remember, there's a limit of 30 meals or equivalent meal components per day. Well, what does that mean? For that matter, what constitutes a meal? It's not defined in the law. One person's meal is different from the next. I'm 6'1", 235 pounds. I can eat a whole pizza. I can eat 6 tacos or a dozen cupcakes, no problem. So we did have to be creative in some decisions to facilitate permitting, supporting new businesses, and honoring the intent of the regulations. Some of those you see here. We counted as 1 meal, 1 serving, 24 ounces of fresh squeezed juice, 1 12-inch pizza, etc. Since cottage food operations were limited to non-hazardous foods, some CFOs became MECOs to expand their menus, since this was a new home-based operation available to them. Next slide, please. So I would guess you've recognized during the presentation there are some aspects of this legislation that are problematic in preventing foodborne illness. Training, training, training is our focus. The food manager certification and food worker certification that we require locally, that's where most of this knowledge is coming from. A lot can happen in 60 days, including forgetting to complete the training. Most of our applicants by far have not been food safety professionals. This is another reason our ordinance includes hygiene and handling requirements that are already in the larger state law as a whole. Commercial principles need to be tweaked to fit into a residential environment. Concepts like sanitizing, taking temperatures properly, minimum food cooking and holding temperatures, cross-contamination, they're new, brand new ideas to many of our applicants. Inspection specialists had to break the retail mindset and be more objective about how these barriers are upheld in a home setting. Because we lose contact through the year, there are likely unapproved menu changes, operational or staff changes, equipment switch outs, and some crazy inspired ideas by amateur chefs, such as the chicken sashimi you see here in the slide. It is a private home, so perhaps it lacks a consistent housekeeping standard. The lack of unannounced inspections raises the concern that we don't see risky conditions or behaviors that may occur when we are not there. But without an echo coming back from the community itself or from the MECOs, we can't be 100% confident that food safety is always the top priority. Next slide, please. So it comes down to this. Can you trust your neighbor to prevent foodborne illness? When I started as a young, wide-eyed inspector in 1995, I would never have dreamed we would be issuing permits to home restaurants. You've heard how MECOs are exempt from many aspects of sanitation as we know it. So it's easy to feel some alarm as a food safety professional, as a regulator, let alone as a customer. Remember, MECOs are generally required to follow the same prevention steps that your favorite restaurant is. How these steps translate to a private home looks different. There are still, however, some less obvious and perhaps unconsidered barriers to illness at work. As mentioned before, there is no cooling, reheating, or reuse allowed. So addition of contaminants, adequate growth time for pathogens, most of those concerns are reduced. There are no special or risky processes allowed. All the food goes from prep to service 24 hours. So again, the window of opportunity for food abuse is shorter. All of these go through a detailed menu review through us, the local health department. And let me tell you, it is detailed, and we get all of our answers before we move forward. There is a production cap on how much food they can serve. Not only does this help limit their interference, or maybe interference isn't a word, competition with brick and mortar restaurants, but it also, if there is an outbreak, hopefully this would limit the extent or scope of that outbreak. There is limited public interest in MECOs. There's sort of an ick factor attached to these sorts of facilities. So for that reason, there is not a whole lot of participation, and most of the MECOs are not coming anywhere near their allowed production caps. And finally, there's a self-interest of the MECO operator themselves. If somebody gets sick, or if we get a lot of complaints, this opportunity goes away in California. And I'm sure they're very well aware of that. So now let's bring it home. Does the micro enterprise home kitchen concept work? Next slide, please. In Riverside County, as far as preparing for implementing the option, absolutely a success. We received the CSAC, California State Association of Counties 2020 Challenge Merit Award, which is a big deal here, in the middle of a pandemic. So I'm very proud of ourselves. Our MECO inventory went up during the statewide lockdowns, but it's since receded to pre-COVID levels. Currently, we have 124 active MECOs. At our peak, we had 164. This, however, has been an exceptionally poor couple of years to gather statistics on the success or failure of the program, or even how to accurately measure success is evolving. However, it is an absolute win that we have not received a single alleged foodborne illness or other contamination complaint. We've received 3 complaints total that were all about outdoor signage, which is not allowed. As other California counties opt in and launch their own MECO programs, we'll learn a lot more about the areas of the law that can be improved. Hopefully, there will be a louder regulatory voice to push for those changes. Next slide, please. So I thank you for the honor to speak about our harrowing jump into the unknown and this seemingly crazy idea of home restaurants.
Well, thank you again, Ken. That was a wonderful presentation. I know our audience enjoyed the opportunity to learn more from your experiences with the home-based restaurants. Well, we do have a couple questions, and I kind of want to get a start. One of the first question we have is, if only places in the home in the initial inspection are available for the initial inspection, who's to say they don't hide stuff in other parts of the house that they don't want you to see, such as foods that are not approved to prepare, or I think they suggested pets or other things that might be often in the establishment. Anything that any experiences there you could add for our audience today?
That is, of course, one of our primary concerns. We do make them promise up ahead of time in their application by describing which areas of the home they are going to use. And we do inspect those at the time of the home inspection. But you're right. If they want to deceive us, they could. And I have no way to demand sort of an inspection warrant to see those other areas. So there is a great deal of trust that goes along with this. Obviously, we don't prohibit pets when it's not operating as a MECO, and we would obviously allow service animals. That's part of our ordinance, but we do require that those things that the home life be kept separate from the MECO life when it's actually active. But obviously, I've been in the business long enough. I agree. I'm concerned about what they're doing. We're not standing there.
So, Ken, we have a second question. So it sounds like there's a prohibition for pets being in the operation while it's operating. Is that, am I understanding that? What about smoking? Any prohibitions there?
During the actual food handling and the operation itself, it is not allowed.
Okay.
We're still concerned about the same hygiene contamination risks that we would in the retail environment.
Absolutely. How about, and great question, are you aware of any foodborne illnesses traced to one of these establishments? I understand that they have a very small volume, so that might be a little harder to detect, but anything that you all have seen in California yet?
We don't have a single foodborne illness complaint. Obviously, yeah, foodborne illness is underreported anyway, and particularly with COVID and flu season coming, it's obviously misidentified, but we can't directly trace a single foodborne illness or even a contamination complaint to any of our permitted MECOs.
What about another question we have is, have you received any feedback from the brick and mortar restaurants or complaints from them that they don't have to comply with the full regs in place for the more traditional restaurants?
We actually reached out to them at the same time we were reaching out to our cities to make sure our local restaurant associations were fully aware. Obviously, the state restaurant association was part of producing the legislation, and there was no real pushback, no concerns. We get more complaints about mobile food operations parking outside of restaurants than MECO competition.
That makes total sense. Is there any dress code for the chefs or the workers in the MECOs?
Interesting question. No, there is no specific requirement that they must wear clothing and where that clothing must be. Obviously, their presentation is part of this whole thing. Yeah, that was a great question. We haven't considered that.
Oh, no, that's interesting. Another one of our viewers today asked the question, you talked a little bit about the inspection criteria, and one of them was to ensure the food safety knowledge. Their question is, how do you measure that? How does that work?
That's generally handled verbally when we are doing the home inspection. So as they demonstrate their procedures with making certain dishes, we don't necessarily ask them to cook, but we ask them to sort of mime it. And we will ask them specific questions like, you know, what's temperature you're going to cook that chicken to, et cetera, et cetera. So we will fold in quizzes or questions into our interaction and into their demonstration to give them an opportunity to show us they understand minimum sanitizer levels and cross-contamination and such.
What about another good question is any requirements related to allergen control, or how has that been addressed in the MECOs?
Nothing currently required beyond what is provided in the food manager training that the operator must take. Our local food worker training program addresses the idea, but doesn't go into detail. It is very simple, very basic, rudimentary food safety policy. So it's only handled officially through the food manager certification training.
That makes sense. What about any training related to norovirus, foodborne illness threats, bare hand contact, those sorts of things done as part of their work?
Those are also included in our application process, the going back and forth with the operator, the home inspection during the actual demonstration of knowledge. And we flood them with all kinds of training opportunities.
Sure.
Pamphlets, informational bulletins we've created, web links, in the hopes that they will do some education on their own.
That's awesome. In regard to cleaning and sanitation practices, do you require they follow the commercial or food code practices, such as the parts per million for approved sanitizers and those sorts of things?
Yes, we do require that they sanitize at commercial levels. Obviously, most of these homes are going to have a 1 or a 2 compartment sink. So we have to come up with a second or a third bin, or maybe they use their dishwasher to wash and rinse, and then they do a sanitizer dip. But they are required to manage the same fundamental food safety procedures that are in all food codes.
So, and I guess there's another kind of follow up to that. Are you requiring them to have an incident cleanup kit available for the bodily fluids?
No, we have not. We do require a first aid kit by ordinance, and we
Okay.
do require a fire extinguisher for grease fires.
Okay.
But we have not required any sort of that cleanup kit like that.
Okay, great. We have a lot of questions coming in. This is definitely lots of coming in from the chat. The next question is, how could they cook chicken if they aren't allowed to cool foods? I'm not sure what the participant's getting at. We might need a little more information. So if that attendee would like to add a little more to that question, I'm not sure what they're asking. Unless were you sure on the question, Ken?
Unless they were referring to the chicken sashimi that I put up there. Obviously,
that might be.
That's the food that we would be. That was the worst case scenario. I was thinking about an inspired amateur chef without training. But I think in general, yeah, the food would be cooked as part of the general, process and preparation of the dish.
Another one of our participants asked, are there any rules about the storage of prescription drugs or human and animal drugs either? So I think they're just thinking about the kitchen might be a common place for people to keep their medications.
It is a common place, and as long as they're not accessing or using those medications and they're stored out of the food prep realm, we don't have any issue with that. Obviously, it is a private home. We're trying to be respectful of that. However, it's more the illnesses that those drugs they're taking may indicate that concern us more than having the drugs around. But as long as they're properly stored and they're not likely to get involved in the food process or mixed in with the MECO foods, we haven't mandated that they be removed from the kitchen.
Okay. The next question we received was, upon review of the application, do you ask about health policies during that review?
Health policies such as a demonstration of food knowledge? Is that what you're...
I think they're asking about employee health, essentially, so that people aren't sick and those sorts of things.
Only in so much as the training information that we give out, all of that stuff is handled very heavily in our required food worker and the required food manager training. But again, there can be up to a gap of up to a week for food workers and up to 2 months for a food manager to get that training. So we do as much pounding of information into people as we can before we leave them at the home inspection. And obviously we have lots of information posted on the website they can access, but we can't force them to view it.
Okay, no, that makes perfect sense. Another person asks about, they have to keep their facility food separate from the households. Do you require separate refrigerators and freezers then, or how does that work?
That has been a tricky one. What we have asked in most cases is that they clear a shelf of the refrigerator, a bottom shelf, and utilize that for their MECO. But either way, if they need to go to multiple shelves, we are requesting that they keep all of those things separate. Optimally, we would have a separate refrigerator, but that's just not a possibility for most of these very small startup businesses.
The chicken question was actually cooking chicken, such as making a chicken salad. It would be cooled. So would that be allowed? And I think that's what they were trying to ask.
Oh, okay. Well, cooling for immediate service is not much of a concern. Obviously, I'm talking about formal cooling to reheat later,
okay,
or bulk batch preparation. None of that stuff would be allowed. But as far as the process, cooling it enough to go onto the dish, my recommendation to that applicant would be to cook that chicken near last, give it just enough cooling time that they can plate it and it does what they want it to do.
Yeah. We had another question. With the MECOs you're seeing, do these tend to be ethnic food providers, or are you seeing an equal distribution across cuisines? Are there specific areas that you tend to see more MECOs in?
Good question. We actually are sprinkled throughout the county. We have every type of menu item you can imagine. Lots of fusion foods, lots of foods I've never heard of, which is also interesting. We're trying to figure out if they can make it safely. So there's a real variety that I, as a consumer, have not seen in restaurants that you can see in some of these Mikos. And we do have a few Mikos that operate as cooking or demonstration classes. So they too go deep into specific ethnic comfort foods or regional foods. But it really has been a nice homogeneous mix across the county of a variety of foods.
It looks like we have another question as it relates to. Sorry, I'm working my way through all of these. Can they use uninspected meat or eggs or vegetables from their own farm or garden?
Good question. I would say uninspected meats, not. They would not be able to do that, at least for the Miko operation. I would consider that more of a higher risk activity. That's not laid out in law, but our law is just vague enough that we can stretch it where we need to. As far as if they wanted to use their own, yes, we have approved that. That was one of the Miko areas that we approved. They have to describe, and we're talking about a little garden for herbs, sure, chilies, not a large estate. But they do have to describe what their farming practices are. If they're adding any chemicals to that, if they're stating it's organic, then they've got to meet those requirements. So for the most part, they're finding it's easier just to do the store-bought, unless it's a specific ingredient that they can't find in a store.
So it looks like we have a couple more questions, and then I kind of have an all-encompassing one that we'll probably wrap up with. So the other questions that we have are there rules such as the individual employee with Hep A can't, or Hep C, sorry, may not prepare foods in the home? Anything like that that you have with Miko?
Yes, we do have, I believe it's in the state law, but I'm sure that it's in our local ordinance that anyone with any sort of contagious disease symptoms has to be excluded from the Miko area and the Miko procedures.
And the next question is, are COO records required for seafood products? And I'm not sure. Amber, if you could give us a little more. The COO is not something that I'm familiar with exactly what you're asking. So if you could add some more detail to that. And country of origin.
You know what? Frankly, I don't believe that we would ever get that deeply into the source of their foods unless we had a complaint that we were trying to backtrack and do some discovery on. We do require that they get all their food from approved food sources. So with that sort of blanket requirement, hopefully it will all be from appropriate retail or wholesale resources.
So with that, I have a couple kind of more all-encompassing questions. With your experience, if you had the opportunity to develop a new state law or a new ordinance related to Mikos, were there things that you might change?
I would define meal. So that removes some of that concern, because there's always going to be those folks that want to push the edge between a single meal or bulk production. I would definitely require the food manager training and employee training up front. It's just, in the retail environment, you have other employees, you have other managers with experience. So there's some oversight. In a private home kitchen, there is no oversight. That person is solely responsible, and there's no way I'm going to show up at some random time to make sure they're doing it correctly. So I would definitely make sure that the training was required up front. Other than that, there's not a whole lot of interaction with the Mikos or with the public about the Mikos. So we haven't built up a robust list of things we'd like to change. Now that more counties are jumping in, more states are considering it, there might be, a better hold on these and better regulatory control. I would also like to see some way to arrange a random inspection, even if that was calling ahead and saying, give me 3 nights that you're going to be operating, because we're going to show up one of those nights. Just for our own public health assurance that things are being done properly. But those are the three big ones.
So I thought we were going to wrap up, but we got a couple more good questions that I want to grab, maybe more. So does your law require that they have liability insurance for the operation?
I don't believe that our ordinance does.
Okay.
That might be required for individual business licenses in the city areas.
Okay.
But I don't know about that. We don't involve in the city permits.
The next question is, are they collecting sales tax? Or are they even required to in California? I don't know that answer.
There's nothing in the legislation that mentions specifically they're required to do that. I would expect our state tax board has heard of this and may have just decided for right now, since it's just Riverside County, no big deal. It's only 124 of these out there. Probably not a big concern, but as there are more, it'll become probably more regulated.
So that actually brings us to another question that I actually got a text message question here as we were sitting here. And the question was, were you able to get additional staff to cover these, particularly with 2 people per inspection and those sort of things? What was your real staffing impact? And did you have to use existing resources, or were you granted some additional resources to do the work?
Zero impact on staffing. We didn't have to take any extra bodies on board. What we did was we worked together as a team for months before this hit. So we were very well prepared. We took each opportunity to inspect a facility as an opportunity to train another inspector. So we just sort of spread the knowledge that way. Fortunately, there was not a flood of MECOs on opening day that we had to deal with. So we've been able to sort of handle them as a slow trickle, and eventually reached the point where all staff is trained to do the application review and the home inspection.
I think the last question that I have is, are they allowed to be open and operate when a person in the household is sick, such as with a reportable foodborne illness?
I would say in general, the way the law and our ordinance is written now, there is nothing to prevent them from doing that. We would obviously recommend that they isolate that person and they would not be allowed to interact during the MECO's operation. But other than that, again, it's part of that leap of faith.
Well, with that, we definitely want to thank Ken for his willingness to share his experience with the MECOs, and also want to welcome all of you. If you have any resources you've developed for something like this for your legislative proposals that might be helpful for others, please do send those to us at afto@afto.org. Or if you have any questions or concerns that you think of afterwards that you'd like to make sure get included in the post documents that'll be going out to everyone, please feel free to send those to afto@afto.org. Once again, thank you very much to all of our participants today, and to Ken for his willingness to talk to us about their experience in California and in Riverside County. We so appreciate that willingness. With that, we're going to go ahead and conclude today's webinar. And yes, the recording will be available after the fact. And thanks again to Ken and to all of you for joining. Have a wonderful afternoon.
You too.
Thanks.